So first of all, I want to introduce Darren Windroff. He's the CEO of CareSpotter. Please welcome Darren to the stage.
Thanks, Kathy. Hey, good afternoon, everyone. I'm Darren Windroff. I'm the founder of CareSpotter. We help families find the perfect caregiver. I want to start out by thanking Florida Blue and Healthbox for this amazing opportunity. I know I speak for every company in the Healthbox portfolio that this is just a tremendous opportunity, and thank you so much for working with startups. Before I talk with you today about CareSpotter, I want to share my story with you and why I started this site. Last year, I needed to hire a home care aide for my mother, who's recovering from cancer surgery. When we left the hospital, they had given us a list of home care agencies, but there were no ratings, no testimonials. There was no way of knowing which were the good agencies and which we should avoid. When I contacted the agency, I wasn't able to speak to the caregiver before they sent them to my mom's home. My mom is the most special person in my life, and at her most vulnerable, I didn't want to risk letting a stranger choose the wrong caregiver for her. So I left my company and I took care of my mom full time. And while that's an experience I would never trade for anything in the world, not everyone has the resources to do that. Every family we spoke with during our research for CareSpotter shared the same story of stress and anxiety, needing a stranger to choose their caregiver for their loved one. We are so empowered in today's world. Technology allows us to customize every detail of our life. Yet amazingly, at our loved ones most vulnerable, we still do not have the ability to choose their caregiver. And this is a growing problem. Every 13 seconds, an American turns 65. By the year 2030, more than 72 million Americans will be age 65 or older. That's 1 in every 5 people. Researchers call this the 2030 problem. And the reason being are the 100 million Americans, 25 million families aged 30 to 45 who will need to take care of their children and their parents and work a full-time job. This is not only a tremendous social issue, it's an economic crisis. Companies lose more than $29 billion annually to the lost productivity of full-time employed caregivers. The way a family finds a caregiver today is they're usually referred at the point of need to an agency, but agencies are tremendously expensive, up to $30 an hour. You're not able to choose your caregiver, and despite their high fees, agencies only pay caregivers a fraction of that, which leads to turnover for the family when the caregiver leaves to find a job that pays a living wage. And this is very disruptive. Now, families can connect with caregivers through sites like Craigslist or word-of-mouth networks, but these are unstructured. You don't know who posts on Craigslist. Families aren't used to reading a caregiver's resume, and that resume doesn't properly convey whether or not that applicant is the right caregiver for that family's loved one. So you have these 3 tremendous problems. You have a rapidly aging population in need of caregivers. You have an unstructured process for families trying to connect with caregivers. And for caregivers, they're disenfranchised, barely making a living wage, yet so desperately needed with little to no incentive to enter or stay in the industry. You know, just by a show of hands, how many people here today have been affected by these issues or know of a family who's struggled to find a caregiver? Yeah, this is a big, big problem. So how do you solve these issues? Well, first, CareSpotter makes it amazingly easy to find an experienced, vetted caregiver. Go to CareSpotter, put in your zip code, hit enter, and instantly you're connected with hundreds of local caregivers. Each caregiver's had a criminal background check, they're insured and bonded through the site, and they've gone through CareSpotter's 5-step vetting process before being allowed to post on the site. From there, you can focus your search using more than 150 search criteria, such as language, experience with a medical condition, even hobbies or interests. CareSpotter is also built on Facebook's social platform, so you can see if you and the caregiver share similar friends on Facebook. You can also see if you both attend some of the same community groups, such as church or the gym. You can see how many hours the caregiver's worked on the site. You can see how far they live away from you, and you can read testimonials from past clients right from their profile. This is the most personal, this type of matching is the most personal match you can make on any platform, offline or online. Then we take that caregiver's resume that wasn't helpful to the family at all, and we turn it into this. A beautiful, elegantly designed profile, the LinkedIn for caregivers. You can see the caregiver's schedule, what skills and services they offer, and most importantly, you can get a feel for whether or not that person is the right caregiver for your loved one. When you find your caregiver, you contact and hire them right through the site, and you manage them through our online care journal. You can also pay them through our secure payment system, and out-of-state family members even receive updates each time the caregiver makes an entry into the care journal. This is truly an amazing application of technology to a market need. So the industry is tremendously fragmented. There are more than 33,000 home care agencies. Most of them are mom and pop owned franchises. There is no one national market leader for finding a caregiver directly. And amazingly, despite the crowded marketplace, all these organizations fail to address one very, very important stakeholder. And that's the caregiver. The caregiver is the one constant. They are healthcare's frontline soldier. A great caregiver empowers an entire family. Now, agencies provide structure, but they don't pay well at all. They barely pay a living wage. And they don't let the caregiver choose their schedule or which families they're matched with. Caregivers and families can connect online, which costs the families less and give the caregiver an opportunity to earn more, but they don't provide structure, ongoing training, or fellow caregiver support. And that's where CareSpotter differs from everything that exists today. We focus on the caregiver. The caregiver is not a means to an end. They're the solution. So when CareSpotter launches in a community, we create a community meetup group for caregivers to get together for support and networking. We also provide monthly webinars for training, and we're going to provide online training as the site grows that the caregiver can show on their profile, further bolstering their marketability. For families, we help guide them through the stressful hiring and management process of the caregiver. And for families who want help choosing their caregiver, we have a concierge service. And for both the families and the caregivers, CareSpotter features an on-site manager if they ever have any questions or concerns. And we're also going to offer incentives through companies looking to reach seniors and caregivers, both of which are extremely influential demographics. CareSpotter makes money through a small 15% service fee we charge for all ongoing payments. Families save up to 30 to 40% by going through our site versus going through an agency. The average monthly revenue for a caregiver working 30 hours a week at $13 an hour would be $234 a month. Everyone here knows this is a big, big market. It's a critical need, it's tremendously inefficient as it exists today, and it's growing rapidly. So CareSpotter launches this month in Orlando, where we'll begin our pilot program. By early 2014, we'll launch Tampa, and by July next year, we'll launch the 4 largest senior care markets in Florida. From there, we'll begin scaling nationally. This is a very ambitious project, but we have an awesome team. I myself am an Army veteran, a returned Peace Corps volunteer. I was a former magazine editor at Men's Health magazine, and most recently, I sold my interest in a successful public accounting firm. Our partners include some of the largest family caregiver, senior care, and direct care worker organizations in the country, and they're going to continue to help us develop our processes and distribution as we scale. So what are we looking for today? We want to connect with community partners who are passionate about innovative solutions to help families and seniors, to host a CareSpotter pilot, to introduce the site as a resource to families looking to connect with talented caregivers. We're also raising a seed round to build out our team, and we want to connect with experienced investors who love working with passionate entrepreneurs. Before I go, I want to leave you with one more thought, and this is very important. There are only 4 kinds of people in this world: those who have been caregivers, those who are caregivers, those who will be caregivers, and those who will need caregivers. And that's everyone here. Caregiving is something that connects everyone here with everyone who's ever been. I'm Darren Wendroff with CareSpotter. Thank you.
Okay, we have just a few minutes to ask some questions of Darren, and so we have some folks walking around with microphones. Does anyone have a question for Darren? Oops. It takes a minute. It takes a minute.
Darren, talk a little bit about how far you've come during the program and how the program, or if the program, helped you crystallize the vision that you have for CareSpotter.
Yeah, it's incredible. So the question was, how far have we come, and how has the program help us develop the vision for CareSpotter? So when we started the program, as you know, Mark, we were just a concept. We had 3 images of what CareSpotter could be. We hadn't developed the back-end system. We had developed one partnership with the Direct Care Alliance of America. Through the program, we've been connected with so many incredible mentors. And mentors that I didn't even know that type of expertise existed in terms of healthcare, in terms of insights into what CareSpotter can do beyond what I envisioned. And it's helped us connect with additional partners, very important partners in the direct care, senior care, and family caregiver industry, and also develop what the vision for the site. When we had first imagined the site, we had imagined connecting families and caregivers. But through the mentors and Healthbox, we were able to take it beyond that in terms of what's important to those families when they connect with caregivers and what's important to the caregivers. So it changed our focus of how we connected the two. And also changed our focus in terms of organizations looking to reach caregivers. In the CareSpotter model, there's a way that organizations, through the dashboard, will be able to send news items or information items to the caregivers and the families. And as we grow, we're going to offer incentives to the caregivers through the hours they work through the site. They're an extremely influential demographic, and I don't think we would have had that insight without the experience in Healthbox and Florida Blue. It really just expanded our vision.
Hey, awesome presentation. Quick question. You know, I spent time actually listening to some of the folks from the AMA talk about the same problem, which is you have this, million people in the world that have some level of accreditation, but there's no physical or quantitative accreditation right now for caregiving. Like I did caregiving for my dad because I had access to WebMD and I was, a pain to the doctors around me. I said, why are you doing this and that? Could you use your rating system? And have you thought about trying to take your rating system and tie it to quality metrics that a health plan might endorse, and thinking through that, you have quality of X and I'd pay a premium for that. And therefore, if you're in a patient-centered medical home, Florida Blue would look at underwriting or eating some of that cost?
Sure. So the question is, how can we take the quality metrics of the caregivers and tie that into payers perhaps or other organizations? There's several ways. So in terms of quality metrics, I'm going to address that in 3 ways. First of all, we're connected with the Direct Care Alliance of America, and they have created the first national accreditation for home health aides. They've already pilot tested in DC. They've had more than 2,000 caregivers who have this accreditation. And as our partners with them, we're going to create a badge on caregivers' profiles and also subsidize them taking that test through the hours they work through the site to get them that credential. So that's one way we address that credential. In terms of connecting CareSpotter to payers, in terms of the ongoing, not accreditation, but the ongoing review of the caregivers. Each time the caregiver sends their invoice to the family, they're going to rate the family. And each time the family receives that invoice from the caregiver, they rate the caregiver. And we're going to receive those ratings internally. That's at the beginning, that's going to provide an internal marker for, are we keeping quality control very high? But as we grow, we'll take that data and learn how to make it into an algorithm to help families better connect with the right caregiver. In terms of connecting to payers, we've explored the HEDA scores, and we're trying to understand more effectively how that can be tied into what CareSpotter does. Families can perhaps opt in to get incentives from connecting with Florida Blue, and we can tie that into the HEDA scores. I think initially the main thing we have to focus on is that engagement between the families and the caregivers. Once we do that, it opens up a whole world of possibility.
Time for one more question?
Just some specifics on the revenue model?
Sure. So CareSpotter charges a 15% service fee for all ongoing payments. So if a caregiver charges $13 an hour, we would charge an extra $1.90, $1.90 an hour on top of that. About $1.95 an hour on top of that. So the total fee would be $14.95, about $15. Home care agencies usually charge between $20 to $30 an hour. Plus, if a family just needs a caregiver for one day, which happens often to full-time employed caregivers, there's no option for that. You can go to an agency, but it's $30 an hour. You're always going to get a different caregiver, and you're not going to be able to choose that caregiver. For what we do, we're perfect for that, for company programs. So our model is based on that 15% service fee. Right now, families pay probably, it's about a 60 to 70% extra charge in terms of what they're paying the caregiver, because the caregivers are paid $9 to $10 an hour and the agencies are charging $20 an hour. Actually, that's about 100%. So the 15% service fee is actually very small compared to what families are paying already to caregivers. And for that, the families get, all the caregivers are insured and bonded, and we've also addressed both sides of the issue, so caregivers don't go outside the site by logging their hours on the site. So for that, the caregivers get their hours logged on the site every hour they work through the site, which helps their marketability. And the caregivers are insured and bonded, and the family has access to a care manager if they ever have any questions or concerns.
All right. Thank you, Darren Windroff, CareSpotter.
Thank you very much.